So I'm going to go through a short story or chain of events, which is something that we hear all the time with reference to this question. If injections or drugs aren't helping me, why on earth is something less invasive like the treatments that we do here at the Mayfair Clinic? So a typical sort of chain of events that someone might undergo is they go to their GP, they get possibly an examination in that 10 minutes, but they walk away with drugs or told to rest. We'll get into the problems with that later, okay? But they get told to rest. That doesn't work. They go back, they maybe get sent for some physiotherapy, and that maybe doesn't work. And then they go for an MRI and they find it's a disc problem. And then they go and get some facet joint injections. Now this is the really funny part. You've got a disc problem and you have facet joint injections and you wonder why they don't work. It's a different structure. Now, the injections sometimes they're used for diagnostic purposes, but patients don't always know this. They try and do an injection of the facet to deduce that if it works, it must have been the facet that was causing the pain rather than the disc. But that's often not communicated to the patient. They just say you're going to go and have injections in the facets, and you're left thinking, well, why am I having facet injections when it was the disc that was identified on the MRI as being problematic, or it was the disc and the facet that was identified as being problematic on the MRI. So this is often why they don't work, because there's just that lack of full understanding as to why you're in pain right now, why your back isn't getting any better, and why in spite of some of these more invasive procedures and strong drugs, it's not really working. Now that's generally a failure to take the time to understand back pain. And generally speaking, back pain is not life-threatening. So there's not the degree of detail is generally not gone into that is required to fully understand what's causing your back pain. Here in the clinic we see these sorts of things time and time again. That set of circumstances that results in back pain lasting maybe 10, 15, 20 years or 2, 3, 4, 6 months or even longer, somewhere in between. It really does vary, but that system that I just outlined, that chain of events, is very often what we hear has happened, and it's no surprise it hasn't worked. 95%-ish of the back pain patients or neck pain patients that come in here to the clinic have a problem that is somewhat self-inflicted, in so much that there are tasks that you're doing on a daily basis that you're not aware of that are contributing to the back pain and preventing it from recovering effectively. And trying to just get in there with some painkillers or getting there with some injections may sometimes provide you with a short-term relief, but quite often it allows you to, ignorant to the problem, continue to do the things that made you bad in the first place. So when you come in to see us, we go through specifically what is going on, what are you doing on a daily basis contributing to your back pain. We'll do imaging to understand how are you standing every day, how are you walking around. Your spine should have in the lower back a nice smooth curve going through it here. Okay, if you're wandering around like that and your hips are over here and your spine's all the way over here, no wonder you're having back pain that's not recovering, because you're walking around in a completely off balance way. It's always fantastic when we get a patient that comes in with their partner and we get the x-rays and we go, right, you stand like this because this is how your partner's standing on a daily basis, and they go, wow, that's really uncomfortable. No wonder they're still in pain and it's not working, because their body's all over the place and no one's taken the time to understand that. When you understand that, you can then make strategies and give a more accurate prognosis for the patient. And that's really, really important. And that is why these sorts of non-invasive approaches work better, because they take into account the fact that back pain is not something you can just do an injection and get rid of in most cases. It's more complex than that. And the examination process that we go through here, which you can read about on our website in the new patient section, is very, very thorough to understand that. The treatments that we have are very comprehensive. They're positive treatments in so much as they are directly opposing some of the forces that have caused the back pain in the first place. For example, a lot of back pain, in fact the majority of it, is a failure of your spine here to deal with the compressive loading of gravity. Maybe in this case, as I mentioned earlier, it's above and beyond what it's designed to be, or maybe you're leaning forwards too far as an example, and that's causing issues. So we do spinal decompression to take pressure off the spine. Other issues are muscle spasm that frequently is misdiagnosed as the problem rather than a symptom of the problem. When muscle spasm over joints, they compress the area further, which doesn't help with healing. So we do work with vibration therapy, which is basically like massage on steroids, to release these muscles a little bit more. It's not the main therapy, but it's helpful, and it fits into the decompression nicely to make it more effective. You also find that you get joints that get stuck, And those joints need to be released, because you can see through here there's lots of little joints in the spine, and they're all designed to take a little bit of the load. And when one or two of those joints, those links, stop working properly, get stiff, you find that other areas in the lower back start to become injured because they're being worked too hard. So we do specific work with adjustments to get these areas moving in a safe way, so that more of those joints can contribute to the normal ranges of motion. And then finally, in these injured tissues, rather than doing injections to numb the pain or those sorts of therapies, we do laser therapy to calm down inflammation, speed up tissue healing, so the area can start to heal properly, rather than be stuck in this cycle of recurrent episodes of acute pain interspersed with areas of chronic discomfort. So you've got healing, you've got taking pressure off the spine, you've got decreasing muscle spasm, you've got increasing mobility. That's how we approach back pain, with that initial information from the examination process that's incredibly thorough to fully understand all the nuances of the patient's case. And then we follow it up with, which is always important, an element of rehabilitation to target specific muscle groups that are weak and strengthen those, and increasing motion in other, for example, the hip joints with reference to the lower back. And that's really important. And that is where physical therapy type approaches, non-invasive approaches, can vastly outperform the more invasive things like injections and taking drugs. Plus, you get none of those side effects that you get with drugs. Some people, they can't go to work on drugs. They're essentially, they're completely out of it because they're taking something to deal with the pain, and it makes them completely unproductive at work. So that's not a viable solution either. So if you've got any more questions about how we approach things, even if you're not in London and you just want to try and look in your local area to see if someone does this sort of therapy, has this sort of detailed approach, go on our website, themayfairclinic.com, and you'll find much more information on what we do, our approach, and why it works.